Have you ever been to sleep in the same room with a person who snores? You definitely know the struggle of having a restless sleep every night. Snoring is caused due to the relaxation of uvula and soft palate. These tissues can relax to partially block the airway, resulting in irregular airflow and vibrations. Other conditions in which snoring can occur include: Number 1. Allergies. People with allergies have irritated and congested airways, which do not allow the airflow smoothly through your nose and throat. It bumps into the surrounding tissues, which causes a vibration, which produces the sound. Number 2. Weight gain. Heavier people have extra tissue and fatty deposits around the neck and throat area. Due to the effects of gravity, it can collapse the muscles, restrict the airway, and leads to snoring. Number 3. Aging. As we age, our tissues lose elasticity and moisture. The drier tissue can cause vibration, causing the sound. Number 4. Smoking. Smoking leads to inflammation, which also reduces the size of the air passageways in your nose and throat. Number 5. Alcohol. Consumption of alcohol also relaxes the muscles of the nose and throat. If you snore when your mouth is fully closed, it is due to your tongue blocking the passageway. If you snore with your mouth open, then it is due to the muscle tone in your throat not allowing oxygen to flow freely without obstruction. Loud snoring should not be ignored as it affects the quality of sleep, and it also carries health risks like higher blood pressure, higher risk of heart attack, stroke, and interruption of breathing. It is a major symptom of obstructive sleep apnea. This is caused by blockage of airway when the soft tissue at the back of the throat collapses and closes when sleeping. If you suffer from central sleep apnea, your airway will not be blocked, but the muscles do not receive a signal to breathe from the brain. Symptoms include waking up in the morning with a dry mouth or headache, bouts of awakening out of breath during the night, excessive sleep during the day. If you find these symptoms, it is better to visit your doctor because untreated sleep apnea may lead to risk of high blood pressure. These are some ways to get rid of snoring naturally. As excess weight around your neck or throat region is likely to narrow your airway and result in snoring, snoring can be reduced by losing some weight. As sleep deprivation is another primary reason for snoring, you must follow proper sleep hygiene, avoid alcohol and quit smoking. Use some essential oils as they help get rid of snoring and other sleeping troubles. Sleeping on your back causes your soft palate and tongue to get back into the throat, leading to loud snores. Sleeping on your side can effectively decrease snoring. Green tea is packed with antioxidants and has anti-inflammatory properties, helps with the muscles of the nose and throat, helps in improving the quality of your sleep, and effectively treats a sore throat from snoring. Like the video if you find it informative. For more health-related videos, subscribe the channel.